First of all, on behalf of IMR Norway, I'd like to thank you for coming to Norway, participating in our conference, and contributing with this interview about IMR.
Thank you. It's great to be here.
So, we go ahead. First of all, could you briefly summarize what is the essence of illness management and recovery?
Well, I would say illness management recovery is a step-by-step program for helping people learn information, strategies, and skills related to managing one's mental illness in order to live a fuller, more independent life and to reach one's personal goals.
Could you elaborate a little on what exactly is recovery?
Yes, well, we think that each individual defines recovery in their own way. Recovery meaning either returning to the kind of life they used to have, or in some cases developing a life in the first place. It's having something rich and meaningful to really make life worth living. And that so for some people that might be having a job. For some people it might be having good relationships. For some it might be expressing their creativity in music or song or literature. So we think that recovery means different things to different people. Could you add anything to that, Ken?
Well, in many ways, this new-fangled definition of recovery differs from traditional medical definitions of recovery that emphasize the remission or elimination of symptoms and impairments. In a way, these new ways of looking at recovery have to do with recovering one's own life, one's sense of meaning, sense of purpose in one's life. And because what is meaningful and what is a sense of purpose is individual to each person, we think that what's important is to define recovery, or to have each person define what recovery means to him and her. And then in the IMR program, what happens is that based on what recovery means to each person, they set goals to bring them closer and closer and to achieve their own personal meaning of recovery.
Could you say a little about how is IMR similar to and different from other recovery-based approaches to mental illness?
By all means. There's a good number of similarities between IMR and other recovery-oriented approaches. Much of IMR is focused on the positive. It's focused on helping people build on their own personal strengths. It's looking at the community as a sea of resources that people can access. There's an emphasis on helping people identify what's important to them and helping them make progress towards changing their lives in ways that they think is important. IMR is a little bit different than at least some other recovery-oriented approaches in that there is a very rich curriculum that is focused on illness self-management, where an important goal of the IMR program is helping people learn about their psychiatric illness in order to participate with other treatment providers and ultimately, ideally, for people to be the leaders in their own treatment. Many other programs that are recovery-oriented are aimed at helping people achieve functional goals like getting back to work or school and improving relationships, but they don't necessarily have this rich curriculum in terms of focusing on illness self-management as a way of helping people work towards recovery goals.
I would say something that comes to my mind as well about what's a bit different about IMR is that people actually practice skills in their sessions around IMR. They're not just talking about things, they're practicing them. So if they're learning a coping skill for coping with stress, then they actually practice it in the session. And they have a home assignment to practice it when they get back to their own community. So it's not something that's it's just talking. There's a lot of action in it.
You have been describing IMR as a set of life skills. Could you say more about who is IMR for?
By all means. IMR was originally developed for people with the major mental illnesses of schizophrenia, schizoaffective disorder, major depression, and bipolar disorder. And in fact, there's some education about those major diagnoses in the IMR materials. But in many ways, IMR is more broadly applicable to people with other disorders as well, other psychiatric disorders, and even more broadly, many of the skills that are taught within IMR can be thought of as life skills. So for example, there's a module on building social support, and everybody needs social support, people who care about them in their lives. There's another module focusing on coping and dealing with stress, effective strategies for reducing stress. And again, stress is a normal part of living. Another one deals with the use of substances. We all need to make decisions about the effects of substances that they have on us, and whether using is helpful or not, or cutting down may be more helpful. And so the educational curriculum about different disorders in IMR can be amended or added to for people with other disorders, such as borderline personality disorder, or obsessive-compulsive disorder, or post-traumatic stress disorder. But many of the core principles that are in IMR can be thought of much more broadly as life skills that people can benefit from learning even if they don't have any psychiatric disorder.
IMR was originally developed for people with major mental disorders like schizophrenia, bipolar disorder, major depression. And there is a curriculum specifically made for these conditions. Now, when you put together a group for the IMR program, how different could the challenges these people are facing be and still be useful for them to be in the same group, the heterogeneity of the population?
That's a great question. Well, first of all, we think that it's possible to have people with different diagnoses participating in an IMR group together. And you could certainly have people with the schizophrenia spectrum disorders and the major mood disorders participating together, bipolar disorder and major depression and schizophrenia. And you could even extend that to having people with other disorders, such as obsessive-compulsive disorder or post-traumatic stress disorder, if one also created some additional curriculum, education about those disorders. The actual disorders that a person has are not that critical to participating and benefiting in IMR, as long as there is some educational information about the nature of those disorders for the participants. When you have a group of people who are working together, participating in an IMR group, what is usually more important is that the people have a relatively similar level of functioning, meaning that their level of cognitive functioning, the amount of distress that they're experiencing related to symptoms is comparable, because that enables the people to work on the curriculum, to support each other in working towards goals together in the same way. One widely used indicator of level of functioning is the Global Assessment of Functioning, or the GAF. This is a 1 to 100 scale that indicates the overall level of functioning that combines psychiatric symptoms and psychosocial functioning. And you don't have to have an extremely narrow range, but the idea is to develop a group where you have people who are in a relatively similar range so that they can progress together and support each other in IMR.
I think they can relate to each other's challenges in similar ways if they're not too far apart in the functioning level. And because we believe that a group can have more than one diagnosis represented, is that we have one of the handouts in IMR addresses all three, the schizophrenia, schizoaffective, bipolar, and depression. Make that all four in a single handout, so that it touches briefly on each of those things. If one were to do a group, say with added persons with PTSD, you might add a little bit of information in there to balance it out so that they would learn something about their own illness if they were.
From your presentation, it seems like IMR is compatible with other approaches, that it kind of holds things together. So there seems to be room for flexibility adapting things. Now the question is, how flexible is it? How much can you deviate from the manual and still be doing IMR?
Well, I think that flexibility part is very important. We do have a lot of curriculum, however, in IMR, so one wants to be flexible in how they use that curriculum. So you might go into more detail about some aspects of IMR than in another area, or you might touch more briefly on another area. But we feel like it's important to have it all there in one manual, so that what clients need the most is sure to be covered within those modules. I also think that everyone deserves a chance to have access to as much information as they can to make informed decisions. So we don't want to assume that someone, in quote, doesn't need any information from that module, that we can titrate it so that it's more or less.
I would put in one other thing, which is that, to me, what holds IMR together really is the setting and the active work towards personal goals that individuals do. They begin by talking about recovery. They set goals based on what recovery means to them. And then there needs to be some degree of regular follow-through on those goals. Sometimes the goals aren't as motivating or as important, or people have difficulty making progress towards them, and they may change and modify those goals. That's a normal part of goal setting. Or people may achieve goals and they need to set new goals. But the idea that people are learning how to manage their illness in order to recover their lives and achieve personal goals related to what recovery means to them, we see that as a fundamental part of recovery as well. Additive of the IMR program, of course.
The final question. If you want to train to be qualified as an IMR therapist, what kind of qualification background is needed in order to have this training?
Right. Well, we don't have a lot of specific requirements in terms of what we believe is important to becoming an IMR clinician. We think that if one has a mental health professional background, it could be a bachelor's level, it could be a master's level, but they have some experience in working with persons who have a severe mental illness. We also, in many places, have service users, people with the mental illnesses themselves, who become co-leaders of groups, sometimes even leaders of groups. Generally, they have had the experience of having participated in IMR, having gone through the curriculum so that they're familiar with it. From that part, they then go on to learn how to become co-leaders of IMR. In addition to having some mental health background or experience in mental health from the lived experience of mental illness, we think it's very helpful for people to participate in training and to have ongoing consultation with an experienced IMR provider. In many ways, we think that the best way to learn IMR is by doing it with the support of other people and ongoing consultation of experienced clinicians. A willingness and interest in learning IMR is, of course, an important ingredient for doing it, but having the support, the professional support, the access to training, some time to prepare for sessions, some time to talk about it afterwards, that kind of administrative or institutional support is very important for people learning how to do it.
Thank you very much for your interview.
Thank you.
Thank you.